This podcast is kindly supported by our friends at Acre Pharmacy, one of the key aesthetic pharmacies leading the way in responsible supply.
So, leading on from my blog that we posted, I think a couple of weeks ago now, that had a lot of interaction. So, we just want to talk a little bit about practitioners speaking about what we think celebrities have had done and popping in our 10 pence piece when maybe it might not be warranted or it might not be valid. So I don't know who wants to start the conversation.
So I think it's definitely clickbait. And I think when you put a celebrity's face on, people tend to have a little look. I think maybe using it in a nicer way as clickbait, you know, the celebrities are out there and any press is good press, people say. But I think maybe it's a little bit cruel when you start tearing down someone else's image. I saw somebody, I can't remember her name, recently on a TV programme, and people were saying, oh, she's obviously had a lot of fillers. And then the actor came out and said that she was on steroids for a condition. And I think obviously we're tearing down someone's appearance. And we know, I am shamelessly will watch the Kardashians. We know that they see the press. We know that they see people's posts about them, and they are human at the end of the day. So I always feel a little bit bad on the injector and on the celebrity when people are harsh about their work.
I do agree, but I also do think that sometimes when people like the Kardashians are endorsing a product, service or procedure, and saying that they've only ever had that done, and it's very obvious that maybe they have had a little tweak. I do think that sometimes when it's educational, informative, and not bashing the person, not saying, you know, what do they look like? I would never have this done. This is a horrible result. Then it can be quite useful. A positive thing. And I think education is key to choosing a well-rounded practitioner. I don't know if that's the word, but choosing somebody that has your maybe best interests at heart, who can educate you. And I think sometimes education is good to kind of get out there and talk about celebrities in a nice way.
That everyone maybe has the right to privacy. If they don't want to tell people what they've had done, everyone, even though they are celebrities, they do have a right to their private life. I don't know if I would like it if someone walked down the street and said, tell me exactly what you've done to your face.
Thing is, I think they do have a right to privacy, but also,
they're in the public eye.
Yeah.
Part of that is to be expected.
I've always said, I want to be successful in this life, but I would never want to be famous, because it is just, you're opening yourself up. Even in what we're doing, we open ourselves up. People always ask me, what do you have done? And I do tell them, but that's because I feel like I would be maybe leading them down the wrong path if I didn't, or I wasn't honest. But I have my right to privacy, but I also have my right to educate people in what treatments I've had done and how I look a certain way. So I think if you're endorsing for your own benefit for a skincare brand that you've decided to produce,
not right.
then they're more than happy to say, you know, I use retinols, I use this and I use that, when it might not be true. But because they don't want to tell people that maybe they've had a tweakment here or there.
Full face, a blatant laser.
I think this
exactly
100%.
I was born this way.
But I think we need to consider the wider implications and popular culture and whatever else it is. And I think there's a lot of issues in the world, without getting too political, right now around how you look, the pressure on that, the pressure that younger generations are feeling to look a certain way, the impact that pressure has. We know all that. Your post is talking about how other people will pick apart celebrities. But again, we're picking them apart against what? The ideology of what we think we should look like, because someone says we should look like that. And I think we need to, yes, there is such a thing as freedom of speech, but who says we have to do A and who says we have to do B? I know they're all popular narratives. I get that. But I just feel there's an element of just let people live. And yes, there's nothing wrong with saying behind closed doors, and this is the look that I want to achieve. But who are we? I'm not saying I agree with these statements or disagree, but who are we to say somebody shouldn't have that? The line that I draw is, I don't sit there and say to someone, you should not have a breast enlargement other than a stop at a D. Anything above a D is ridiculous. I don't care. My issue is functionality, anatomy, and existence. If what you're having done poses a threat to you, if what you're having done, whether it's a surgical or non-surgical, poses an interruption to or a distortion to your anatomy, that is not normal to me. That is, in a way, self-harm. In a way.
Yeah.
If we're having that much filler in our lips that we damage our salivary glands, we can't smile, we can't animate, it distances ourselves from our social circles psychologically, that has an impact. That to me is self-harm. If somebody is putting so much filler in their under eye that it's distorting their tissues and making them look alienized, that to me is an element. So I get that there is a graduation, a range of stuff, but I do think it's part of a bigger picture. And I wrote a blog that went live only today, and it's about this influencer. I mean, I did a rant on my personal page this week about a patient who'd had a total of 9 quite significant plastic surgeries in the course of 2 sessions, 5 days apart. 2 of those surgeries would have been horrendous and monstrous and debilitating. And I've even reached out to 3 or 4 of my plastic surgeon friends and said, I'm not being dramatic. This is extreme, isn't it? And they'd never in their life heard of anyone having this level of surgery. And when she came into the clinic with necrosis, with seromas, with infections left, right and centre, again, not systemic, luckily for her, with a blood clot, with broken, compromised tissue, her first answer was to show me her phone at the influencer who endorsed that plastic surgery. And I rarely go and have an unprofessional rant on my social media platform because I don't think it's the place, but I did because I was upset. And one of the girls come into my room afterwards and said, why are you upset? I went, I'm upset because I'm angry. And I have no other way to vent it. Like, this woman could die. Like, genuinely, I'm not being dramatic.
Yeah.
This woman could drop down dead. She could get sepsis. She could well have a blood clot. She's gone under for 2 periods of time. I imagine with my plastic surgery brain, 11 hours of surgery probably initially, maybe 7 hours under the next time. That's significant. That's ridiculous. Where does it end? And off the back of a celebrity going and having 5 of those procedures in one go and presenting a really quick recovery. I bounced back from this. Look at me going to the gym. Look at me drinking my designer Slurpee. Look how easy this is. I'm sat here drinking a porn star by the pool. No, you're not. No, you're not. So I think it's a wider issue that we have in the culture at the minute of this pressure that we feel and the extreme lengths people are prepared to go to it because someone told them they should do it.
So that influencer, obviously, then the surgeon has a duty of care. So 100%. That's one influence.
So then they go abroad to have it done where they don't really care.
It's then taking that person that's done that and blasting them all over social media and saying, look what they've done. This is kind of 2 things. It's like a fine line between being unprofessional and cruel. Like if you had taken that patient and posted her photo and saying, look what she's had done, and look at the damage, it would be detrimental to that patient. 100%. So I think it's like kind of slightly like 2 different issues, really.
100%.
I think it's hard as well because you've got on one side of the fence, you've got, I don't want to admit what I've had done for whatever reason. And young girls think that, they've had skincare, so I'm going to look like, I don't know. Kylie Jenner from the skincare, when it probably isn't just skincare alone. But then you've also got the dangers of admitting what you've had done. So then people will go for these extreme procedures knowing that this person has had that done. So what do? Maybe that's why you just say nothing. So then people kind of question it and they can make their own decision on what they would like to have done.
So hard.
I think
based on guesswork.
You know what though? I think for the majority of us, we all say safe. And this is the key, isn't it? Safe aesthetic treatments done by safe practitioners. Nothing's ever safe, but by and large, reputable, ethical procedures. When we start blurring those lines, or when I see influencers endorse crazy trends by what I would class rogue injectors, and I'm allowed to say it's an opinion, then I think surely you have a responsibility not to do that.
Yeah.
Now, clearly you need educating, and that's fine. But therefore, should you then be passing that information on to vulnerable people, young people. Like, we went to one of the colleges in our area recently I say recently, a few months back, to do a talk to their sixth form, because we'd had 3 parents into our clinic with their teenagers with corrections. And I said, we can't correct we can't treat you until you're 18. And it was, when I spoke to these girls, they will not say where they've been. It's all very shush-hush. They've all crept off together. But let's be fair, someone is injecting them. These girls clearly are 14. Yeah. Someone is treating them. Yeah. So this is a bigger, wider issue, isn't it?
I think you hit the nail on the head.
It's a wider issue, but I think it's looking at a celebrity and having a frustration because they're saying they look 21 because they've drowned in olive oil is one thing. But I think the frustration, I think we need to be clear about why it's frustrating. It's frustrating because as practitioners, we see women who are in their 60s, who've never used skincare, who've smoked heavily, who've potentially not had an easy life, who've never ever done anything to their face before, come in with very severe aesthetic issues to be fixed, thinking they can fix it with olive oil.
Yeah.
And I think that is the frustration. So we need to probably vocalise that a little bit better. And maybe the education of that is, this can't be achieved. Some people just have pretty good genetics, and that's the thing. We have to also respect that. But I think the frustration from us is because it creates this image that things can be fixed easily, damage can be repaired easily. And also, even when we say, don't worry about having extreme work, it can be fixed easily. Complications can be resolved easily. So there's that popular narrative. I think, our friend Gillian Murray recently put a comment on it's become a popular culture for people to talk about complication rectification now. Look at these horrible lips that I fixed. Yeah. That's still someone's face.
Yeah, exactly.
That's still a trauma. That's still something that they didn't want. So we have to just be a little bit more responsible for what we're saying.
I think, though, the issue is also, obviously popular culture, but like even in a TV program recently, they spoke about, there was 2 different cases on there, and it was about faces and how people are altering their faces to achieve whatever they want to achieve. And there was one young girl that had her lips done I think she'd had them done when she was 16, and then they were following her up when she was 18. So she'd gone to a respectable practitioner in her mind, and she'd had her lips filled again at the age of 18. But the practitioner that was doing had her hair down, had a long lab coat on. So it was no no bare below the elbow, nothing like that. So that in itself is, an education point. And also there was another lady that had gone and had her nose done because she wanted to look like a Bratz doll. So, that is an issue. That is a massive issue. But there's no referral there, but there's no education, and that's on television, and we're being taught that that's okay, that's absolutely fine. So there's an issue of education, like you were saying.
You've seen Dr. Rivkin recently doing quite a lot of content showing extreme surgeries taking place in, I think, Korea it was, where people are having quite old-fashioned techniques of facelift done. And they are literally...
Was it the Black Swan?
The Black Swan was one, and then something else. But the thing is, this is what we're fighting against. And again, we can sit here all we want, but this is a part of a much bigger problem.
Yeah.
This is a much bigger problem. We were recently in one of the newspapers, we were featured in a couple of the radio shows at national level recently about us saying about health tourism. And I got bashed off people going, are you saying you can't go abroad for surgery? Absolutely not. You're not hearing me. I'm not saying don't go abroad for surgery. I am saying go to reputable places. And then the question is, how do we know? Well, not from an influencer.
Yeah. No. People are so ready to be offended.
Of course they are.
But not educated.
The top and bottom of it is when we're seeing, we did a data poll, and I say there, facts make me feel calm. Yeah. I don't ever say anything I can't back up. We did a data poll, and out of 27 post-surgical cases that we reviewed in 1 month, 97% of them were from Turkey and 100% of them had a complication.
Yeah.
Varying from as significant as insignificant as a poor aesthetic result, with severe, and it wasn't even just any of that. Each one of them had something, whether it was they'd had a blood transfusion, whether they had, one of them had stitches up her back that she didn't even know why they were there, and she didn't ask why they were there. And that concerns me. You've got now a 10 centimetre scar on a lateral point of your back with no explanation and no one giving it you. Somebody else with a trauma to the back of their head and they don't know why and no one will explain them. This is not care. This is not okay. And that's, these are not okay. These are not normal experiences. And we have got to stop normalizing that experience. When I say, I had experience, and yes, we did mention Turkey, but the data told us in that particular data pool, they were all from Turkey. So I'm going by the facts which can be validated at any point. And the point, I'm not saying there are not good surgeons in Turkey. Of course they are. I know many. But we have this influencer culture endorsing extreme surgeries with links in Turkey. They're going over to have a breast augmentation. They're coming back with a new nose, a temple lift, a cheek lift, liposuction and a BBL. And then they're flying home in 3 days. And I've had one patient who's in our clinic currently who was on a flight with her drains. No way.
And
this is not okay. Tell me where in the world is that okay? No, it's not. So I'm allowed to say that and someone needs to make noise about it. And if that makes me unpopular, so be it. But if it stops someone sat at home on the fence about whether they should go there or pay a few thousand extra and go to somewhere, pay a few thousand extra. Yeah. Pay it. Because these are people who now have we shared one on our story last week. She had a horrendous experience and now feels that her aesthetic is worse than it was at the beginning. And now she can't afford to get that rectified. This is sad, but it's not okay. And we do the same with aesthetic procedures. We see people going, look, come here and have this and have that and have a 10 mil package. And it's not okay.
Yeah. Increasing the mill, you see them increasing mills, putting discounts on it. We had a clinic, it's a surgeon in the UK, you've probably all been reached out by them, who have asked us to do a referral code to use them. They work, doesn't matter your qualifications, any injector. And then I saw they did this influencer, she's 21, an upper and lower bleph, a nose job and a boob job. She's 21 years old having an upper and lower bleph.
And don't get me wrong, disclaimer, there may be some individuals who genetically need to have that. We're not saying that's not the case. Need to have that. This is the thing.
But using it because she has a high following, using it as clickbait. She's a very, very beautiful young girl who still looks very, very beautiful, but people will think that maybe she needed that procedure and that is what's made her so beautiful. She didn't need the procedure and she's still beautiful, but it's hard, isn't it?
Sadly, we see things going in the headlines. That woman who'd gone over and had a gastric bypass and died when she got back, a mother of two, really sad. I'm a fan. I'm going to say I'm a fan of plastic surgery. I'm all right with plastic surgery. It's part of my world. When I see a patient, if I feel that their result is not achievable non-surgically, I will present them with a surgical solution. There's nothing wrong with that. I'm not demonising it. I'm all for it. But what I have an issue with is when I see patients in my clinic who were a size 14, who got together with a group on a WhatsApp group. We were put together because of their surgeon put them in the group together. So they become almost like a little, it's a cult mentality. Let's be fair, call it for what it is. It becomes, if they're having it, we're all saying the same. This is my surroundings. We're all the same. They're wrong. This mentality grows, this basic psychological things, this sociological impact of cult culture where you surround yourself with people who think the same as you. They're all endorsing, they're all having it, and they all fly out there together like a little holiday and have it done. And it's very much glamorized. These girls are in their 20s having a gastric bypass or significant surgery, weight loss surgery, because they want to lose a stone. Come on. Do they understand the implications, how their body will take medication for the rest of their life, how their nutritional impact, how it may impact them in that sense, how their hair may fall out, how they'll have health problems for the rest of their life, how then life will never be the same again. You know, how socially it can impact them because they're no longer going to be able to enjoy that experience with their friends. Come on. And I'm not saying these things are bad, but it is about choosing if a patient is suitable. If, you know, if it's not okay, and it baffles me. And I think the world is slowly heading in the right direction. I just can't see it changing soon.
No.
And I think we need to take a little bit, and we're not surgeons. Not yet. No, I'm joking. We're not surgeons. We're not. But we can still have the same impact, positive and negative. So we hold the tools to cause damage. And some of the complications that we see are just as debilitating.
Yeah. I think as a whole, education is key and will always be key. But I think there's a right way to do it. And
Holy, that changed, didn't it?
yeah,
Started on Instagram posts.
I'm coming back. I'm bringing it back.
No, but it's a great, you know what? It's all linked.
Yeah,
know,
no,
it's all
definitely,
linked.
because it does, one feeds into the other. Because, you know, social media, it is a massive, massive platform, and people will always see it as a money-making machine.
But you know what? You said a really good, it is a money maker, but
machine.
you said a really good point before we started this. You said, if you look at the views on these posts, they go massive.
Yeah.
So therefore we have an ethical decision. Do we do it because it will grow my platform? So am I going to do this for personal gain, even though ethically it's wrong?
Yeah.
And that, I mean, again, other people might not think it's ethically wrong. We all can make our own decisions. And if you don't, then that's absolutely great. I'm not saying that you, like you've just said, and I agree with you, Megan, you can,
There's a right way to do
but there's
it.
a right way to do it. And I think we all got really bored of the recent celebrity where we was just analysing her tear troughs beyond repute. And it's like, come on.
Yeah.
All you have to do is walk around the ACE conference and there's plenty of tear troughs you can analyse. You don't need to
And they'll actually tell you what they've had
and they'll
done.
actually say, there's no need. There's just no need. And also, you know, what did your mum teach you when you was 5? When you can't say anything nice, don't say it at all.
She's
Yeah.
a young girl.
Let's take it back. Let's just take it back. We,
Yeah.
you know,
Human.
Yeah,
She
I mean,
is
there's
still a
education
human.
there, definitely, to talk about the anatomy behind it, but please don't bosh people.
yeah, I think we just,
Unnecessary.
it isn't necessary.
I'd cry.
Yeah,
I would genuinely cry.
yeah. No,
Same. Don't analyse my tear troughs.
Please.
yeah,
tired
please don't
because I'm
analyse
tired, all
mine. Thanks. That's a good way to end.